Okay, so it's recording. Can you still see my screen, guys? Okay, perfect. So, okay, great. So today, my topic is about the facial nerve and its clinical correlations. Okay, so just two quick questions. Which cranial nerve is the facial nerve? Is it the first, the second? Do you guys know? No. So facial nerve is the seventh cranial nerve. Do you know if it has a sensory or motor function? Just take a guess, guys. We need your participation for your participation marks. That's why I'm asking questions. It is both. Yeah, it has a sensory and a motor function. Okay. So, right. Let's start. The facial nerve, like I said, it has a motor and sensory function. So, for the motor function, it's responsible for controlling the muscles of facial expression. So, the muscles of the face that help us generate expressions like showing that I'm happy or showing that I'm sad, like for expressing doubt, for expressing contempt, for expressing fear. So, this is the motor function of the facial nerve. It controls those muscles that enable us to display an emotion. Okay, so I'll share this story with you guys. So I went on a date with someone 2 years ago, and he said, "I have a really cute smile." And he asked, "What makes you smile?" And I said, "My seventh cranial nerve." And so but he didn't appreciate the joke. But anyway, yeah, it's a good way to remember. So anything that any muscle that contributes to facial expressions is being controlled by the facial nerve. So that's the motor function. Apart from that, it supplies other muscles of the head. So certain muscles involved with swallowing, with jaw movements, with the muscles of the external ear, and the stapedius muscle. So this stapedius muscle, I think my colleagues mentioned this last week. So the stapedius muscle, interestingly, it is the smallest muscle in the whole body, small skeletal muscle, and it dampens loud noises. Okay, so you don't hear the noises that loud when it comes to your ear. So that's the motor function. The sensory function, it receives sensory information from the outer ear. So it provides sensory innervation to like the pinna or the auricle, this bit, and the like the external ear canal. Sensations like pain, temperature, and touch. So if someone's touching my outer ear, that sensory signal is being conveyed by the facial nerve. Okay, and also for sensory, it is responsible for innervating the anterior two-thirds of the tongue for taste. Okay, so any taste sensation that we taste from the anterior to the most like forward aspect of the tongue, the first two-thirds, the anterior two-thirds of the tongue, that's being conveyed or carried by the facial nerve, okay, via the chordae tympani. Also, the facial nerve has a parasympathetic function. So it innervates a lot of the glands in the face and in the head, including like the lacrimal glands for like tear production, tear production, submandibular and the sublingual salivary glands for the production of saliva, and the mucous glands of the nose, the paranasal sinuses, and the palate. So to summarize, for facial nerve, that has motor function, controlling muscles of facial expression. It has a sensory function. So the sensory function, it carries sensory information from like the outer ear and the anterior two-thirds of the tongue for taste. Okay. And the last function is like parasympathetic nervous system innervation. So it provides innervation to like the glands in the face, including like the salivary glands in the submandibular and sublingual areas, the lacrimal glands, and other mucous glands like in the nose and in the paranasal sinuses. Is that clear? Okay, I'll move on. Yeah, just stop me if you have any questions. So this is there are loads of nuclei associated with the facial nerve. Can someone just quickly remind me what nuclei or a nucleus mean in terms of neurology? I think I mentioned this last week. Do you remember what a nucleus is? No? Okay. So a nucleus is a group of cell bodies inside the central nervous system. That's all it is. If it's outside the central nervous system, it's called a ganglion. Okay, so nucleus is a group of cell bodies inside the central nervous system, inside the brain and inside the spinal cord. So there are loads of nuclei associated with the facial nerve. And just a bit of orientation. This is the posterior view of the brainstem. So if you cut me like in a coronal plane and you look at my brainstem from the back, this is what you're gonna see. So here we have the thalamus, and it comes in pairs. Most things in the brain, they come in pairs. Apart from your pineal gland, there's only one. So we have a pair of like the thalamus, and then the midbrain, the pons, and the medulla. Okay, so these nuclei, they reside in the brainstem. So the first nuclei here in red is the facial motor nucleus. So this is where the efferent fibers come out and innervate those muscles of facial expression. Okay, so facial motor nucleus gives innervation, motor innervation to those facial muscles to help us convey facial expressions. The superior salivary nucleus, that one in blue, don't know if you can see it, again, they all come in pairs. So that one in blue, superior salivary nucleus, it provides parasympathetic nervous system innervation to the salivary glands as well as the lacrimal glands. Okay, the nucleus of solitary tract, or the nucleus of tractus solitarius, that's responsible for carrying taste sensations from the anterior two-thirds of the tongue. The spinal trigeminal nucleus, we met this last week. I talked about this extensively last week for the trigeminal nerve. So it also does something for like the facial nerve. So it carries information, sensory information from like the outer ear. Okay, sensory like pain, temperature, touch. So these are the nuclei associated with the facial nerve. Okay, can I move on? Okay. So just going into a bit more detail about the motor function. So you can see here, these are the five motor branches of the facial nerve. Okay, we have five motor branches of the facial nerve. So including the temporal branch, the zygomaticus or zygomatic branch, the buccal, marginal mandibular, and the cervical branch. Five branches. Okay. So the temporal branch, it innervates muscles like the frontalis and the corrugator supercilii and the orbicularis oculi. So the frontalis is responsible for elevating the eyebrows. And the other two, corrugator supercilii and orbicularis oculi, they depress the eyebrows. Okay? The zygomatic branch, it innervates muscles like the orbicularis oculi. So the orbicularis oculi is responsible for closing the eyelids, for closing the eyelid. The seventh cranial nerve is not responsible for opening the eyelid because that is done by cranial nerve 3. So the muscle for opening the eyelid is the superior palpebrae, the levator palpebrae superioris, and that is innervated by cranial nerve 3. So this can be a tricky exam question. So which nerve is responsible for closing the eyelid? That's cranial nerve 7. But for opening it, it's the cranial nerve 3, the oculomotor. Okay. The buccal branch, it has the orbicularis oris for closing the lip, buccinator for, again, swallowing, chewing, because the buccinator, it helps us compress the cheeks. Okay, so orbicularis oris and the buccinator, I mentioned last week as well when we talked about trigeminal nerve. And I told you orbicularis oris and buccinator are also muscles of mastication, but they are not innervated by trigeminal nerve. They are innervated by the facial nerve. Okay, the zygomaticus muscle lifts the upper lip. Okay, so the buccal branches play a role in like swallowing, chewing, speaking, smiling. Okay, the next branch is the marginal mandibular branch. This includes the mentalis muscle, expressing doubt, contempt, labii inferioris. Again, it helps depress and invert the lower lip. So it basically helps me frown like that. These are the muscles responsible for like frowning. Same with the cervical branch. The platysma opens the mouth and pulls the corners of the lips to the side to create a frown. So these are the five motor branches of the facial nerve. And we can test these functions in clinical practice. So we can test each like branch. So for instance, to test the temporal branch, we can ask the patient to like elevate their eyebrows or to wrinkle their forehead. So if they can do that, obviously temporal branch is working. The zygomaticus branch, we can ask them to close their eyes and we can test the strength. So we can say, close your eyes, your eyelids, don't let me open it. So we're testing for normal strength, and again, we're testing for the zygomatic branch, particularly the orbicularis oris, which is responsible for closing the eyelid. Remember, for opening the eyelid is cranial nerve 3, okay? Not 7. It's only for closing the eyelid. So the buccal branch, the marginal mandibular cervical, we can ask them to smile with teeth. So if they can smile with teeth, then these are working. We can also ask them to frown to test marginal mandibular cervical branch. We can also ask them to puff up their cheeks like so. If they can do that, then obviously all of these things are working because all of the muscles here work in tandem to be able to do this. Okay? So that's how we test these motor functions. Is this clear? Thank you. Okay. So we have other, so that not us, the cranial nerve 7 has other motor innervations. So we have the posterior auricular nerve. It innervates the muscles of the outer ear. So like I already said, the auricle, the pinna. Um, and some people can move their pinna. I can't do that. And the nerve to the posterior belly of the digastric. So digastric, where is it? I'm not wearing my contacts, I can't see. Okay, so the posterior, oh here, posterior belly of the digastric muscle. So the digastric muscle is a suprahyoid muscle, which means it's responsible for elevating the hyoid bone. So this is the hyoid bone. You can actually feel this. So the elevating the hyoid bone is important for helping us swallow. Okay, so if you swallow, you can feel that this is there's some movement here that's kind of pushing the condenser of our mouth like up and like inside. Okay, so these are the muscles responsible for that. So the posterior belly of the digastric as well as the stylohyoid muscle. So the facial nerve gives innervations to these muscles. So the posterior belly of the digastric, the stylohyoid muscle, which are suprahyoid muscles, responsible for elevating the hyoid bone to help us swallow things. Okay, these are the other motor innervations. Is this bit clear? Okay. So for I told you the facial nerve has sensory functions as well. So the outer ear, any sensation, so we feel pain, touch, temperature. Also, more importantly, it gives taste. It carries taste information from the anterior two-thirds of the tongue via the chordae tympani. So chordae tympani is a branch of facial nerve that carries taste information from the anterior two-thirds of the tongue to our brain. So what do I mean by anterior two-thirds? So if this is the tongue, the the anterior two-thirds would be this bit. Yeah, this the back is obviously the posterior one-third. So for the anterior two-thirds of the tongue, this bit, yeah, any taste sensation, anything like sweet, sour, salty, bitter, umami, those kind of taste sensations are being carried by the chordae tympani, which is a branch of cranial nerve 7. So you might be asking, so what happens in the posterior one-third of the tongue? Those taste sensations are being carried by the glossopharyngeal nerve, not by the seventh cranial nerve. So I'm just gonna. So here we have the glossopharyngeal, which is 9. Is 9? Yeah, I think so. So 9, and then for this bit, it's the cranial nerve 7. Okay, so that's for taste. Okay, for anything else, for temperature, for touch, for pain, in the anterior two-thirds, it's the lingual branch of the trigeminal nerve. So don't get confused when they ask you what carries taste sensations from the anterior two-thirds of the tongue to the brain. It's the seventh cranial nerve. But what carries pain, temperature, touch sensations from the anterior two-thirds of the tongue to the brain? That's the trigeminal nerve, the lingual branch of the trigeminal nerve. If they ask you what carries touch, pain, temperature and touch pain, temperature, what else? Pain sensations from the posterior one third of the tongue. That's the glossopharyngeal. So it can be a bit confusing. And in terms of motor function, in terms of us being able to actually move our tongue to articulate words, that motor function is by the hypoglossal nerve, cranial nerve 12. Okay, so it's crazy. The tongue is really strange. But anyway, for this lesson, I want you to remember chordate tympani innervates the anterior two-thirds of the tongue, carries taste sensation. Is this clear? Okay. Yeah? I'll ask you questions later, so I hope you understand. Right. This is the last function. It has parasympathetic functions, which basically means it innervates like glands, lacrimal glands, salivary glands for producing saliva in the submandibular and sublingual areas, and the mucous glands of the nose and the paranasal sinuses. That's all you need to know, okay, for parasympathetic functions. So, in terms of clinical correlation, we have one specific disease for cranial nerve 7. So, we have Bell's palsy. I don't know if you've heard of this. This is basically dysfunction of cranial nerve 7. So, in terms of etiology, so what causes this? It's mainly idiopathic. Do you know what idiopathic means? What does idiopathic mean, guys? Okay. Idiopathic means that we don't actually know what causes it. No one has. Yeah, so basically, the cause is unknown. It's a big question mark. Nobody knows. Idiopathic. Okay. So most of the time, Bell's palsy, we don't know what actually causes it, but they have several theories. They postulated that perhaps there could be a viral cause. So, for instance, I was reading a paper. It was about the reactivation of herpes virus. Reactivation of herpes virus can give rise to Bell's palsy. That's one. It can be inflammation in the one of the like the nuclei of the cranial nerve 7, or in the nerve itself, inflammation in like those areas, or reduced blood supply to the nerve or to the associated nuclei. So any of these things can cause Bell's palsy, but most of the time it's idiopathic. We don't know why Bell's palsy happens. Okay. So, in terms of presentation, it presents as acute. Listen to the keywords: acute onset. So it's not chronic. Okay, it doesn't last for that long. Typically just a few months, and it doesn't build up over time. It's not like, okay, I'm slowly getting paralysis of my face. No, it's like so acute. It happens all of a sudden. Of unilateral facial weakness or paralysis. So not the whole face is involved, it's only one side, either the right side or either the left side, as you see in this picture. Okay, it's only one side that is involved. Um, and another keywords here, both the upper and lower parts of the face are involved. Why am I stressing this? Both the upper and lower parts of the face involved, because if you think about the differentials, stroke is a big differential. In stroke, the patient would be able to like raise their eye. Okay, if this side is affected, obviously in a stroke patient they would have facial droop, but they would still be able to raise their eyebrows and wrinkle their forehead. But in Bell's palsy, because the upper and lower parts are involved, they won't be able to raise their eyebrows or like close their eyelids at all. Okay, is that clear? That's very important. Okay, sorry. Okay, this is really, really important because if you get presented in real life a patient with facial droop, we need to exclude stroke. Okay? Bell's palsy is not deadly, stroke is. So you need to know the difference. Okay. Diagnosis. This is typically diagnosed by exclusion. So we have to exclude all the other differentials, mainly stroke. Also, Lyme's disease can cause similar presentation, like unilateral facial droop. If it's Lyme's disease, don't give them like corticosteroids. No, you're gonna make it worse. So in terms of treatment, usually we don't require any treatment for Bell's palsy because most cases resolve in a couple of months. Okay, we only give treatment if we know it's of a viral origin, if we know it's reactivation of like some virus, then we can give them some antiviral. Also, we can give them, like, if we know it's inflammation based, then we can give them a short course of corticosteroid, not long term corticosteroid, like literally short duration. Okay, and we can give them an eye patch to wear at night, because remember the orbicularis oculi being innervated by cranial nerve 7 is not working in this case, so they are able to open their eyelid because the cranial nerve 3 is working for the levator palpebrae superioris, but for the orbicularis oculi, for closing the eyelid, that's not working. So they're gonna have permanent open eyes, and that's gonna cause dryness in the eye and corneal abrasion. So we can give them a patch to wear at night, or artificial tears as well, just to moisten the eye. Okay. Prognosis, very good. 80% of the patients recover completely without treatment and without permanent damage within a couple of months. Okay. So is this bit clear? This is the last slide, guys, and just questions, and I'll pass you on. Do you have any questions about Bell's palsy? No? Okay then. Okay, this I was gonna try explain why in stroke we we don't have we still get the upper face working. It's quite complicated, so I'm gonna skip this because we don't have time. But just remember, Bell's palsy, both the upper and lower part of the affected side of the face are like they're not working. They're paralyzed. In stroke, the upper part is still gonna work. They are still able to wrinkle their forehead, still able to like blink. They're still able to raise their eyebrows. Okay. Question one: five motor branches that innervate. Can't speak. Five motor branches that innervate muscles of facial expression are all of these except which one? You need to participate, guys, for your participation marks. E, maxillary. Yes, that's correct. Maxillary is the division of the trigeminal nerve, which we spoke about last week. Okay. Does everyone get this? Why it's E? Right. So remember, five motor branches include temporal, zygomatic, buccal, marginal, mandibular, and cervical. Okay. Maxillary, no, that's for trigeminal. Question two. The chordae tympani is a branch of the facial nerve that carries what kind of sensations from what part of the tongue? Chordae tympani, branch of the facial nerve, carries what type of sensation from what part of the tongue? Yes, perfect. Yes, you guys are getting this. I'm really happy. So, A, touch, pain, and temperature on the anterior two-thirds of the tongue. Do you remember what carries this? I said it briefly. So, this is the Yes, that's that's the facial nerve. So, chordae tympani, you're right, it's C. Anterior two-thirds of the tongue for taste. So, I'm talking about A. Touch, pain, and temperature on the anterior two-third is carried by the lingual branch of trigeminal nerve, of cranial nerve 5. For B, touch, pain, and temperature on the posterior two-third is carried by the glossopharyngeal nerve, cranial nerve 9. Taste on the posterior side, posterior two-thirds, again glossopharyngeal. So you guys are correct, it's C. Okay? And for the motor, by the way, motor innervation of the tongue is hypoglossal, cranial nerve 12. Right, question three. I only have five questions, so this is going to be quick. The following are functions of the facial nerve except, so which is not a function of the facial nerve? D. How about the others? Do you agree? Is it D? What do you guys think? Leanne, what do you think? Yes, yeah, it's deep. Yeah. So all of these, so controlling the muscles of facial expression, obviously trigeminal nerve, the motor part, receive sensory information from the outer ear, the pinna, the external ear canal, and the taste buds on the anterior two thirds, again facial nerve via the chordate tympani, supplies the glands like the salivatory glands and the lacrimal, again cranial nerve 7, controls the muscles of mastication. Well, we have some muscles of mastication for facial nerve, the zygomaticus, the buccinator, orbicularis oris. But these ones that are written here, temporalis, medial lateral pterygoid, and the masseters, these are controlled by trigeminal nerve. Okay, trigeminal nerve. So you're right again. I'm happy. Question 4. The facial nerve gives motor innervation to the following muscles except. So what? Which muscle is not being innervated by facial nerve? So A, posterior belly of the digastric, which is suprahyoid muscle, stylohyoid muscle, again for swallowing, for moving that hyoid bone upwards, enable us to swallow. The orbicularis oris, which is responsible for closing the eyelid. Buccinator, responsible for compressing the cheeks to help us again swallow, chew, even like smile. Or is it the levator palpebrae superioris, responsible for elevating the eyebrows? Which one? E. Yes, it is E. Yeah. Levator palpebrae superioris is innervated by the ocular